Hey everyone, Dr. Andrew Orr speaking. Look, I wanted to thank everyone for commenting on my post about hysterectomy doesn't cure endometriosis. And every time I put this statement up, which is actually a fact, it does cause a little bit of controversy. The reason that it probably does is that a lot of people actually don't understand the facts, and they probably don't read the post either. So if you'd actually read the post, you'd actually see why a hysterectomy doesn't cure endometriosis. So we have to understand the disease too. And one of the things is too that a lot of people that get help when they have a hysterectomy is that they have another disease called adenomyosis, and it actually hasn't been diagnosed. So I'm going to talk a little bit about this, but just before I start, I need everyone to understand this. And the statement is purely around endometriosis. Now, hysterectomy does not cure endometriosis at all. So we're going to look at that word cure. There is no cure for endometriosis. A hysterectomy is not going to cure endometriosis. Now, if your symptoms go away and you become asymptomatic, that doesn't mean you're cured. It just means that your symptoms are no longer there, and that's great, but you will still have endometriosis. So let's have a look, and let me explain a little bit, because a lot of people aren't quite understanding. So here is my uterus. I shouldn't really joke about that, but the problem is, let's have a look at when we talk about the uterus itself. Now, when we're talking about hysterectomy, there are a couple of forms of hysterectomy. So we have a total hysterectomy, or we have a partial hysterectomy. So a partial hysterectomy basically is just taking the uterus out itself. It's leaving the ovaries behind and some of the other structures behind. When we have a total hysterectomy, we take the ovaries, we take the uterus, and the cervix is taken as well. So that's what I have to people to understand too. Now, when we're talking about endometriosis, endometriosis is not inside the uterus. I need people to understand that. Endometriosis is not inside the uterus. It is endometrial-like tissue, and it's growing outside the uterine environment. So it's in the pelvic cavity. So when your pelvis is sitting here like so, basically, and your uterus is sitting there, a lot of endometriosis is out here. It's not in here. When we're talking about in here, this is called what we call adenomyosis. So I need people to get that. This is adenomyosis. Now, adenomyosis and endometriosis will present with exactly the same symptoms, except with adenomyosis, you'll get a lot more bleeding symptoms, but you'll get all the same similar symptoms to endometriosis. Now, a lot of women actually have adenomyosis and endometriosis together. Whether they're being diagnosed or not is a completely different story. We know that it often takes up to 10 years or more. Some women take up to 20 years or more to get diagnosed for endometriosis, and a lot of them are missed and dismissed along the way. So a lot of people aren't diagnosed with adeno either. Now, when we're talking about the definitive diagnosis for endometriosis, the definitive diagnosis is via a laparoscopy, okay? So they do a laparoscopy, keyhole surgery. They go in, and they also take some histology. So they take some of the tissue away and they send it away to be tested, and that confirms it. So that's the definitive diagnosis. Scans, let me make this clear. Ultrasounds and scans are not a definitive diagnosis for endometriosis, never were, never will be. Most women have superficial endometriosis. Sometimes some scans will pick up deep infiltrating endometriosis, but it won't pick up the superficial stuff. So that's what I need people to understand as well. Now, when we're doing the diagnosis for adenomyosis, we do a high contrast ultrasound with a special fluid and Doppler and all kinds of stuff. Or we can do what we call an MRI, and that will actually show up adenomyosis. So there is a diagnostic for adenomyosis, and what we typically see with adenomyosis, so while the uterus is this size here, we generally see that the uterus is quite bulky with adenomyosis because it's inflamed. And then, you know, we can have other things. So while I saw on my post, you know, there was people saying, you know, I have fibroids and other things and cysts and things like that. I just need to bring it back to the subject of endometriosis, because if you have a big fibroid, or, you know, in the endometrium and the myometrium, and, you know, and look, the fibroids are causing you issues, yes, a hysterectomy will help with that. And a lot of the time when the fibroids are that big, the only way you're actually going to get rid of them is take them out. And as long as you've had all your children, often they'll do a hysterectomy at the same time, because really it's about quality of life. And that's what we have to talk about. Forget our own views on the subject and things like that. A lot of women do get quality of life back from a hysterectomy, from issues like big fibroids and, you know, adenomyosis for a start. You know, a lot of them are bleeding all the time, and it's uncontrollable. So they do get their life back. Now, the women that often say that, well, I've had an endometriosis and I had a hysterectomy and now I don't have symptoms. Well, what you have to understand is that every woman that has endometriosis has different symptoms. You all have the same disease state, but it presents very differently in each woman. Now, there are similarities, and you will all have similar symptoms, but not every woman has the same symptoms. And this is why endometriosis can't be treated by the masses, so to speak. It has to be individualized. So we see that some women will have a hysterectomy. When I'll talk about this in a minute. But anyway, they have a hysterectomy and it helps their symptoms. And that's because a lot of their symptoms tend to be more menstrual related. So if you take away the uterus, they're not having a period anymore, then some of their symptoms go. But let's face it, that we have to talk about endometriosis as well. That endometriosis isn't always about pain, and it isn't always about menstrual symptoms. That women can have flare-ups at any time in their cycle. It doesn't even have to be related to the menses at all, for symptoms like endobelly and, you know, related musculoskeletal symptoms and things like that. So I have to be really, really clear. So, okay, so we take the uterus out. Say, just for instance, you just have endometriosis. If we take the uterus out and endometriosis is out here, it's not going to cure your endometriosis. I just need to make that clear again. If endometriosis is not in the uterus, which it's not, then taking the uterus away, you're taking away a healthy uterus, if you get what I mean. Yes, again, some women, as I just mentioned before, get symptomatic relief because they're not getting menstrual cycle, and some of their symptoms are more related to their menstrual cycle. Sure, it will help that, but your endometriosis isn't cured. Your endometriosis is still there in the pelvic cavity. So you have to understand that, because the reason I'm trying to get it through to people is that so that if you have a flare-up after you've had a hysterectomy and you're thinking endometriosis is gone because I've had a hysterectomy, and then all these symptoms, and then people start fobbing you off, you're going to think, oh, well, it can't be that. It's not endometriosis because I've had a hysterectomy. Well, that's not the truth. Your endometriosis is still there. The endometriosis can flare. Look, the whole main aim of treatment with endometriosis is management. And if we could manage every woman to become asymptomatic, meaning no symptoms, this is fantastic. This is what we actually want. But the endometriosis is still there. I often explain it like, for instance, I have asthma. And tonight it's a little bit cold, so I've got a little bit of a wheeze there. But most of the time I manage my symptoms. It doesn't mean that I always have asthma. But sometimes it flares up. And it can be from the cold, it could be from emotional issues, it could be all kinds of things. So I can't get rid of it, but I can control it and manage it, if you know what I mean. And it's the same with endometriosis. When we talk about adenomyosis, you can have a look at the post that I just put up about hysterectomy not curing endometriosis, because there's a bit there. And I've also done a post previously on adenomyosis, and I'll put it back up again to explain what adenomyosis. And again, endometriosis and adenomyosis are basically one and the same disease, and but they're in different locations. So adenomyosis is just confined into the endometrium here and into the uterine tissue. So doing a hysterectomy, taking the uterus out, will help adenomyosis. And this is what happens for a lot of people when they get relief from pain and symptoms. They've actually had adenomyosis, plus they've had endometriosis. And this is where the issue is, because then they think their endometriosis is gone because they've had a hysterectomy, but they haven't. The other thing is, I saw people talking about estrogens and stuff like that. I have to just let you know that a woman is an estrogen secreting being, and that you need estrogen. It's a very important part of your makeup. You need it for bone health, you need it for hormones, you need it for looking vibrant and beautiful and so forth. So we need estrogen. You can't get rid of estrogen out of your body. But what we do know that estrogen does drive endometriosis. So that's why we don't want too many external estrogens, you know, like hormone replacement, exogenous estrogens, which will come in. You know, we've got environmental estrogens as well, like plastics, preservatives and things like that. So we do have environmental estrogens will impact as well, phytoestrogens and so forth as well. And they will drive the disease. So that's what we have to be very careful of as well. Progesterone is suppressive of endometriosis, but it doesn't cure endometriosis. So the one thing I need to talk about is that even with the disease, you know, even with the best medical treatment, surgery, painkillers, you know, progestins, you know, different medications that are coming out onto the market, hormones, all sorts of things, we know that women are still in pain and still suffering. So this is why I always talk that you have to have a multi-modality approach to endometriosis. You have to treat it from all levels. You can't just treat it purely on a medical level. Yes, surgery is needed for the diagnosis, but it can also offer symptomatic relief from lesions that have been expressed and so forth, and give women some relief. And then you try and get in and suppress the disease and use painkillers and all kinds of things. And we're using things like nerve blocks now, Botox, and there's all kinds of things that you can use now to help with pain and pain management. But, you know, when I talk about the team approach, it might mean that you've got to get a pelvic floor physio involved. You know, things like acupuncture and Chinese medicine and so forth may help with it as well. Then you might go and do exercise therapy, and you might go and see a counsellor, and it's all about managing, controlling pain symptoms, and from every angle. And again, each and every one of you is very different in what you get. And look, people go, you know, it could be foods that trigger your stomach and so forth. A lot of the time, those are endometriosis or adenomyosis symptoms. Now, the one thing I'm always intrigued by, that people go, you know, that doctors don't know what the symptoms are. But when we actually look at the guidelines and the treatment for the disease, there is some clear-cut symptoms. And this is, I'll just show you, I'll bring it up, so forth. And here we go. So this is from the Royal College of Obstetricians and Gynecologists. So it talks about the investigation and management of endometriosis. And it talks about the background of endometriosis, what it's like. It's endometrial-like tissue outside the uterus. So here it is in black and white for you. This is what I like about things like this, and which induces a chronic inflammatory reaction. So, and it can affect every woman, really, it can. And we don't know what the cause is yet, but we do know there is a genetic component to it, and we know there's a hereditary component to it. So the hard thing is we don't know whether mum, dad side, it can come down dad's side, it can come down mum's side, it can skip generations. Things with genetic issues are really, really funny. And I honestly believe that genetics is where we're going to find the cure for endometriosis, if we can. Then we have to exclude other things like adenomyosis, which I'm trying to discuss with you, because exactly the same symptoms you get, it's exactly the same disease basically. And the main symptom you'll get more with adenomyosis is more the bleeding symptoms. So we get a lot more heavy bleeding and so forth. Then we've got interstitial cystitis and then pelvic floor spasm, all kinds of stuff. But let's go down and have a look at what the clear-cut symptoms are. Okay, so we get the dysmenorrhea, severe dysmenorrhea, heavy, or we get painful periods. Then we get the pain with sex as well. So some women get pain with intercourse, some don't. It's like some people get endobelly, some don't. You know, it's different for, but a lot of women I do know experience pain with sex, because what happens in the pelvic wall, basically in the vaginal wall, we get hypertonus and everything turns on and becomes really, really tight, inflamed, overreactive. Then we get the chronic pelvic pain, we get ovulation pain. There's other symptoms like bowel and bladder issues, digestive, gastrointestinal symptoms. IBS, look, whenever I hear the word irritable bowel syndrome, and in a woman, and then they can't find the cause of it, I bet you 99% of the time it's endometriosis. Because a lot of women are diagnosed with IBS when really it is endometriosis. And this is why it takes so long to, but there's clear-cut symptoms. Again, infertility, but let's be clear on this, that endometriosis doesn't always cause infertility. It's although women with endometriosis are up to 50% more likely to have issues having babies, but it doesn't mean you're infertile. So if anyone tells you that you're infertile because you have endometriosis, kick them in the behind. But it can make it harder. So this is why early intervention and early treatment from a young age is very, very important for future fertility outcomes. And yes, teenagers are not too young to have endometriosis. So this is what I keep talking about. Again, a lot of these are in my posts. Fatigue is a big part. Chronic inflammation causes fatigue. And then when we're talking with adenomyosis and endometriosis, a lot of women tend to be iron deficient as well, and that can be where the fatigue comes from. Also the emotional fatigue, inflammation, not sleeping, living with a chronic disease daily, depression, anxiety, the whole lot come into it as well. And let's not forget the endobelly. You know, women can look like they're 9 months pregnant. And then women can have pain on bowel movements. They can have loose bowels, constipation. Some women suffer incredible constipation, where others will suffer, loose bowels and things like that. But the thing is, the predictive value is there. We know there's clear-cut symptoms, but often, I don't know why people, I go through the list, do you have clotted periods? Do you have pain with your periods? Do you have this? Do you have that? Do you have that? But some women, actually a significant portion of women with endometriosis are asymptomatic, meaning that they don't have any symptoms. So this is the hard one. And these are usually the ones that turn up in your clinic, say, I'm having a hard time having a baby, and run all the diagnostics and so forth. Then they end up having a laparoscopy, and then they find it. And this is, it's quite bad, because a lot of it does overlap with other conditions, as I said, like IBS. A lot of bladder issues too with endo. We see a lot of women that get UTI-like symptoms, but with no infection. So the disease itself is very, very, very complex. But let me rest assured that the only way to diagnose endometriosis via laparoscopy, it's a gold standard investigation, and we do that with histology as well. So, when we have a look at what the disease is, as I said, it is quite hard. So I'm going to bring up some pictures of what endo looks like. For you all to have a look. So, and this is hard because the other thing we tend to see is that, even the people that are supposed to know what they're doing get it wrong. So as you can see here, this is endometriosis, and they're showing the classic red flame lesions, they're showing the gunpowder burn and so forth. But see the white stuff there? That's endometriosis as well. And you can actually see that there's endometriosis all through here. So the color of endometriosis can be white, black, brown, yellow, red. And then it can be just that like normal tissue color too before the lesions express. So even this is straight out of a medical textbook. Even this is wrong. So, what chance does anyone else have? I'll just show you again some of the, what else it can actually cause. When I just bring it up, bladder endometriosis. So I'll just, this one's a pretty good one that we can actually show. Okay, bring this up. Let's make it bigger. So here we see endometriosis in the pelvic cavity here, and also it's around the bladder as well. And you can see the uterus down the bottom there, I'm sorry. So again, if you've got endometriosis out here in the pelvic cavity, right? Let's look at this. Out in the pelvic cavity, and the uterus is there. If we take away the uterus, that endometriosis is still there. Is that correct? Yes, it's correct. So this is what I'm trying to explain to you all, that once you've got endometriosis, you know, there is no cure for it. I'll try and find another couple of pictures for you just to explain again, because I think it's really important that, that you all understand. So let's have a look here. Again, let's, okay, so we're having a look on a laparoscopy here. So when you go in and do a laparoscopy and have a look, so there's the uterus there, you can see the bladder, you can see the colon, the bowel, and things like that, you can see the spine. Now, again, if endometriosis was in the pelvic cavity there, or out in the abdomen, up in the diaphragm, so forth, by taking the uterus away, it's not taking your endometriosis away. So it's giving you this false impression that it's going to help it. So that's what I'm trying to get through to people. Again, yes, if you've got adenomyosis, yes, doing a hysterectomy, partial or full hysterectomy, will help with adenomyosis because you're taking the uterus away. So we have to understand what a partial and a full hysterectomy is. The other thing is that some people, like I said, they do get some symptomatic relief from not having a period anymore, because some of their endometriosis symptoms are actually related to their period. So, yeah, so, but not all are. So it doesn't always relate to your menstrual cycle, and that's what I'm trying to say. Then we have the added issue that some women are being diagnosed with endometriosis and don't know they have adenomyosis. And that's the issue. So for a lot of you, when you end up having a hysterectomy, what's actually happened is you've had adenomyosis as well, and that's where a lot of the your relief is coming from. And then because the endometriosis, you're told that you are now cured, and then you start getting all these gastrointestinal symptoms and pain and referred pain and body aches and things like that that are related to endometriosis and fatigue and all that. Then you think, oh, I don't have it anymore, but you need to know that you still have endometriosis. So I hope that explains it a little bit. I probably confused you a little bit, but I thought that it's really, really important that I speak to you about this. I've just not long got home. I've seen a lot of you comment, and I thought, you know what, we really need to talk about this. So I hope that's helped. Maybe we should do a Facebook Live or something on it where people can comment. But I hope that dispels some of the myths and stuff around this. And we'll talk a little bit more at length. I'll put up my post on adenomyosis very, very soon as well. And yeah, so I hope that's explained. So whenever I talk about hysterectomy does not cure endometriosis, please don't get upset if you've had a hysterectomy, because some of you have had to have a hysterectomy to get quality of life back. There might have been other issues. Like I said, you know, some people said they've got fibroids, things like that. Yes, it can give you quality of life back. And some of you have had adenomyosis that hasn't been diagnosed. It'll help all the bleeding symptoms. That's what hysterectomy will help. But there is an emotional reason. You know, we're taking away a uterus, we're taking away part of you. And yeah, there's an emotional attachment to that as well, obviously, and it's a very, very, very sensitive topic. And no one explains this really, really well. And a lot of it's all in print media and things like that. And we need to get out there and talk about it more and help women to understand in a very caring, honest nature, because people want answers and they aren't getting the answers. And a lot of people are being missed and dismissed. And this is why it takes up to 10 years to diagnose things like endometriosis. If you do want to see a great story on what adenomyosis, go to Endometriosis Australia, which is www.endometriosisaustralia.org. There's a brilliant piece in there. Go into blogs, and there's a brilliant piece in there by Professor Jason Abbott about adenomyosis and what it is. Go into the facts page on Endometriosis Australia's page as well. It'll show you, that all the facts around endometriosis. You've got my page too, the facts of endometriosis. But we need to start talking a little bit more about endometriosis and adenomyosis, because a lot of people have the same disease. All right, I've spoken enough. I hope that really helps you. Sorry, this is a little bit of a longer post, but I really need you to understand more about this disease. And just remember that I'm here to present the facts, and I'm here to look after people, hold your hand, care for people. Yeah, and it is important. I've got loved ones with the disease, and I see lots of people with the disease, and I do lots of work around the education of endometriosis, polycystic, adenomyosis, so forth. So I'm here to help. Yeah, so, all right, I am going to leave it there. And if you have any questions, put them in the post, and I'll try and answer them for you. Take care, everyone.